Hello and
Okay.
welcome. My name is Diana Gabriel. I'm the Director of Operations at Washington Global. We are so excited to have the Elaine Ellis Center of Health here to have a conversation with us today about all things COVID-19. Um, so before we dive into our meeting, I would like to introduce Mr. Timothy Walker, the Chief Operating Officer at Elaine Ellis.
Well, good afternoon, everyone. More specifically, all the families of Washington Global. It's certainly an honor and a privilege to participate. We have been working with Washington Global for the school year and partnering to provide COVID-19 testing for staff and students and even family of the students, should they be interested in participating, just to ensure that that environment is kept as safe and as productive as possible. In doing that, I have had the luxury of working with leadership and was introduced to the opportunity for our organization to serve as your health care resource, where it's an opportunity for us to provide insight and information, dispelling some of the misunderstandings that have so rampantly infested our community, and just provide information as your healthcare resource. But before doing that, I'd just like to make a very short and succinct introduction to our organization, who we are, how we got started, and the like. So with that, we are the Elaine Ellis Center of Health. We are a federally qualified health center, which in short means that we are funded by the federal government, more specifically, Health Resources and Services Administration. The acronym is HRSA, and this health center program under the umbrella of HRSA was designed specifically to be a resource for underserved communities, providing very convenient access to healthcare and the plethora of healthcare services that are so badly needed in underserved communities, more specifically, like the ones that we serve. We have a location in Northeast Washington, D.C. We have a second location in College Park, Maryland. But in offering these services to the population that we serve, we do it with a certain goal in mind, and that is to remove as many barriers to care as possible. So certainly cost is one of the more principal challenges to gaining very comprehensive access to healthcare. So if anyone presents, whether they have insurance, whether they can't afford it out of pocket or not, we are encumbered and charged by the federal government to develop some means to offer those services to those that might present. We have a sliding fee scale that, if you qualify, can enable us to offer discounted services and discounted costs associated with those services, or free services where there's no charge at all. We offer all of the services from family medicine, of course, to include pediatrics, obstetrics and gynecology. We offer adult medicine, of course, internal medicine more specifically. We have substance abuse for those that might be in need of it, behavioral health services, along with dental health services. So the entire spectrum of healthcare to serve the entire family. And we do it with just a spirit of giving and service. That's our mission at the Elaine Ellis Center of Health. And in partnering with Washington Global, we wanted to essentially bring that same brand of service to your learning environment. And that's what we do very regularly. Every 2 weeks, we offer COVID-19 services to your team. And I'm fortunate to have with me from our group, Dr. Gwendolyn Dunmore, who serves as our Chief Medical Officer. And she's taken the role of leading our COVID-19 response here at Elaine Ellis Center of Health. She's worked very closely with the federal government, all of the local governments here in DC and in Maryland, coordinating and facilitating our response to COVID-19, to include testing and the vaccine that we offer to the communities we serve. So she's intimately familiar with all of the details and dynamics surrounding the virus. She is not only a seasoned professional, but has a wealth of experience with all of the different dynamics of services that we offer. So with that, I'd like to introduce Dr. Dunmore, who can more specifically speak to COVID-19. Dr. Dunmore.
Hello, and thank you, Mr. Walker, for the introduction, and thank you everybody for inviting me to be here today. I am generally, as Mr. Walker says, been very into the COVID situation since it started. And basically what I would like to do is just to address some of the key issues about the coronavirus, because it's still new to scientists as well as everyone else. So the information that we gather daily may change. So from 2019, when we first began the pandemic internationally, until it has come the pandemic here in the United States, many things have changed. So what I want to first discuss is what is COVID-19. COVID-19 is a type of a coronavirus. And coronaviruses are very common in the population. Coronaviruses cause cold symptoms, usually sinus congestion, nasal congestion, sore throats. So at some point in everybody's life, they may have had a coronavirus. However, the COVID-19 is a new variant of the coronaviruses. So this new coronavirus 19 was not seen in a human population before. It was seen first in Wuhan, China in 2019. So there are coronavirus variants in animals, and some of the common animals you may have heard about would be bats and cats, those type of things, as well as humans. So with the COVID-19 virus, it is very infectious, and it can range from mild symptoms, asymptomatic, all the way to severe and death, as we know. The transmission of COVID-19 is through person-to-person contact for humans. So it's usually through droplets, and droplets are spread most commonly by a cough or touch, so shaking somebody's hand after they've coughed in their hand, or if there's droplets, the bacteria has rested on articles. We can also, if we touch the articles and then touch our face, mouth, ears, not ears, but mouth, nose, and eyes, we can pass the virus to ourselves from those articles. So those are the main sources of transmission for humans. And it's interesting to note that the virus outside of the body and outside of droplets, the amount of time that it can stay live and infectious varies depending on what the product is. So for instance, certain metals like copper, it may only last a few hours. So after a few hours, you can no longer get the virus from contact there. But they've been shown in some cases that in plastics or items that may last for days. So you can come back later and touch something, the virus might still be active. And if you touched your mouth, nose, or eyes, you can also contract the virus. So that's why it's very important to wash your hands with soap and water every time you're touching things and before touching things, if you can, to disinfect items before you touch them, because we don't know particularly how long a virus may be active on certain surfaces. Now, as far as the risk factors, right now, the reason the government has decided to tier how the vaccine is given to people is because first we had a shortage of vaccine, which means you can't just offer it to everybody at one time. You want to get the people who are most likely to suffer from the most severe forms of the illness. So those were based on age, and statistics were showing that people over 65 and 70 were more likely, if they got the virus, to succumb to the virus or pass away. So that's the first group of people who would be inoculated with the virus vaccine. The next group of people would be those who in jobs that are going to put them at risk, where they would be exposed to people all the time. So the tiers were developed in every city and state in the country based on the likelihood of people who got the infection becoming seriously ill. The for our information, what we looked at is age, of course, people who had chronic illnesses, to include kidney or lung disease, heart disease, diabetes, people who might have a weakened immune system because they were either receiving chemotherapy for certain conditions, HIV positive patients. Those type of people were in the first highest risk groups. Right now we have key ways of preventing. As I said before, is just an ordinary day, washing with soap and water. Your hands, when you wash your hands, it should be at least for 20 seconds. And so I'm sure that everybody heard the little sing the happy birthday song when you're washing your hands, because that song usually lasts, if you're like me, longer than 20 seconds, but 20 to 30 seconds when you sing that song. And if you're washing your whole the hands the same amount of time, then you're likely successful at keeping bacteria off your hands. And also to having wipes and disinfectant around. Sanitizers for your hands should be alcohol-based, okay? So that when you're doing the hand sanitizing, if you're not near soap and water, that's also good means to disinfect. If you're at home, you want to make sure you have a bleach type disinfectant mixed with water. So you may have a mild dilution of the bleach, and you can clean down everything, doorknobs, the tabletop, toilet seats, anywhere where somebody else might have touched, light switches on the wall, anything that anybody commonly touches that you're also going to touch, you want to just make sure that on a regular basis it's wiped down. Now, some of the other things we want to know, other than right now, since we have the vaccines available, the number one way to prevent infection with the coronavirus is to be vaccinated. And we have right now, the Pfizer vaccine was the first to be presented. We have the Moderna vaccine, and we have the Janssen J&J available in the United States, and all are being given. So to talk about the differences between the vaccine, the Pfizer vaccine is a 2-dose vaccine, and the means of storage are a little bit different than others. Hello, somebody must have joined. Okay, so the means of storage for the Pfizer vaccine were a little different. So at first, when it came out, just the routine everyday centers and provider offices couldn't store it. So it was mostly a vaccine that was seen in hospitals or pharmacies because they had the storage capabilities. Now, some of that vaccine is able to be stored in conditions in which you may see it in the community, and it is the same virus, same effectiveness. It's found to be 90 to 95% effective at preventing COVID infection, and is shown to be 100% effective in preventing hospitalizations or severe illness for the COVID vaccination. So this vaccine is a 2-dose, as I mentioned, and the second dose cannot be given before 21 days. So you'll have a 21-day window for those 2 doses. The Pfizer vaccine is what we call an mRNA vaccine. Now, the mRNA vaccine is a new type of vaccine. However, it does not have any virus active in it. As you've seen those pictures of the little red spiky virus, that's the coronavirus that you've seen on different websites. The little spikes carry information, and that's how the virus enters the human cell to infect it. So what this mRNA virus vaccine does is it looks at the genetic makeup of what's in that spike, and it's making that, it causes the body to make a protein, an antibody, to attack that genetic information. So that's what's in the vaccine. You get the vaccine, and then what will happen is your body gets to recognize this as being foreign. And so it's starting to create antibodies, which is why you get the little soreness and everything that's going on in your body, because you're getting an immune reaction to that protein. So what ideally happens is if you come across the COVID vaccine, your body has already seen part of that genetic makeup, and it is now ready to come out full force and attack the virus before it can actually get in your cells and cause you to be ill. So that's the design of the mRNA vaccine. And the Moderna is also another type of mRNA vaccine. So they work similarly. The Moderna is also about 90% effective against preventing infection with COVID-19, and it is shown to be up to 85 to 90% effective in preventing severe illness from coronavirus. So the 2 doses of the Moderna are spaced 28 days to 42 days apart. The last vaccine that's available here so far is the Janssen J&J. That's the single dose vaccine. And with the J&J, it's shown to be 85% effective in preventing the coronavirus vaccine, but up to 100% effective in preventing severe illness. So it's also a great alternative vaccine. Some of the questions have come up about vaccines because of hearing about an EUA, which is an emergency use authorization. That does not mean that the vaccine skipped any necessary steps in becoming produced. What an EUA means is that once the vaccine was created, the usual steps is it has to go through investigation and trials with different types of populations. It has to be seen what the effectiveness is. It has to see how many people actually get ill from it or from the disease is supposed to protect you against. So there's certain steps that are research items. When the vaccine has collected this data, it presents it to the governing bodies to decide if they're going to approve the vaccine. What the emergency use does is just asking the same types of questions, but it's not requiring you to give the amount of time of data that you need. So they still want to make sure it's effective. They want to make sure what age groups it will apply to. They want to know what kind of side effects you've had from it. So there are still times that the vaccine has to go through in trials with populations before it can be presented. So when people think it's a shortcut, it was rushed to production, it was rushed into the system. That's not really the case with the vaccines. So I wanted to touch on the EUA. Now, another thing that I have heard questions about is the variance in the symptoms. So we want to know that some patients do not display symptoms and can be infected with the virus. So that's why screening tests are very important, because sometimes it'll pick up those patients who might be in risk areas, don't know they have the virus, and they're transmitting it to other people. So that's the screening tests do that. But people who have fever, cough, feeling really, really tired, shaky body, chills and aches, headaches, sore throat, nasal congestion, some of those are the milder symptoms. Loss of taste and smell, nausea, diarrhea, we've heard about those. Anybody having those symptoms in this pandemic time are usually going to be asked to be tested for COVID. The ones we get concerned about and is we know a person is ill, but then they start having chest pains or shortness of breath more consistently, or they seem confused when you talk to them and ask questions. They're not as responsive as quickly, or you may even notice a paleness or bluishness to their lips or skin or fingernails. And they seem extremely tired they always want to sleep. This is because the oxygen levels are now becoming a problem and they're not perfusing the body the way they should. So these are the patients that really need to go to the hospital and be treated. Now, I touched on some of the main points that I wanted to make sure we talked about, but I know there might be other questions that maybe faculty or anybody else may have heard that I might be able to discuss.
So I actually did read an article today that one other fairly common symptom that people are experiencing is like pink eye. Um, and so, just being aware of some of these other newer symptoms, especially as the new variants, really ramp up in, just across the country.
Right, that's true. And yes, because as more is known now, there's even certain rashes that have been associated with the new variants mostly. For instance, you can start having a flat discoloration to the skin on different parts. You can have hives all of a sudden where you're just breaking out and scratching and seeing hives. So sometimes those are reactions that they have been noticing in patients with the variants. And I did want to mention that the vaccines have been shown to be effective against the variants. The amount of effectiveness has not been determined yet, but they are displaying some effectiveness against the variants. And the variants have been shown to be more infectious than the variety we've already been used to. So it is extremely important to be vaccinated, because if we get another wave, it's going to be with the variants. And those will put more people, and especially younger people, into the hospital.
Dr. Dunmore, this is Timothy Walker again from Elaine Ellis Center of Health. If you don't mind just speaking very specifically, if someone receives a COVID-19 test or the COVID-19 vaccine, is that in fact, just to be clear, putting the virus in their system?
No, the vaccines we have do not put the virus in your system. These COVID vaccinations are only using genetic material of the virus, so they cannot cause an infection from the virus. They're just trying to help the body to recognize pieces of the virus, so that when the whole virus actually gets in your system, that little piece is a signal that we need to attack this virus.
Got it. Thank you for that.
Dr. Dunmore, I've heard, some people have preferences in the brand of vaccine they're choosing. Do you recommend that people just get the first vaccine that's offered to them, or should people kind of look around for different, the different brands and the differences between them? What's your medical suggestion?
Well, I tend to agree with Dr. Fauci on that one, that the vaccines we have are very effective. Okay, so just get what is available to you. Okay, the 2-dose ones are just as effective as the 1 dose in preventing hospitalizations from severe disease. So, because what you're running the risk of is, if you're waiting to get the vaccine that you want or think you want, if you happen to come across somebody with COVID in the meantime, you're going to get sick. And then at that point, you cannot be vaccinated when you have an acute illness from COVID. You'll have to wait until that acute illness is over. And we don't know, we can't predict how you are going to respond to that illness. You might be mild, or you might be severe, or you might succumb to the illness. We have no way of predicting.
Dr. Dunmore, I've heard from some people that they are concerned about getting an actual COVID-19 test. So, whether it's, maybe someone's congested and their doctor tells them that they should go get a COVID test. So, based on conversations that I've had with people, they're really concerned that if they do get one of the COVID PCR tests, that they will actually get COVID from the test. Is that accurate or not so much?
No, the COVID tests do not have any virus on them, no virus particles. All the test is doing, we know what the genetic makeup of the virus is. So the test is designed to take your secretions and then try and match them against what we know is for the virus. Okay, so that if that shows up, then yes, you're infected, but it does not give you the virus.
Okay, well, I have more then. So, I've heard even from family members of mine that, they really don't think COVID-19 is a big deal. It's nothing worse than a flu. What would you say to someone who really doesn't think that the pandemic is as severe as it is?
Unfortunately, it's hard unless you are personally hit with something with family members or neighbors, or when you actually see somebody very sick, it's hard to kind of just see the news and say, okay, this exists. But when you know that you're going in a hospital every day and that they're not allowing you in certain places, and in the hospitals, uh, you can't even get a bed because I do hospital work. So I mean, I can't do surgery on patients because everything is full of COVID patients. Um, and you have to take the same precautions or more precautions in those kind of settings. So it's hard for people to kind of, some people are seers to believers, and others are not. But this is serious, internationally, not just here. And as we've been told, the United States has been hit very hard, compared to other nations. So I tell people it is real. And like I said, it's still novel, new in the fact that we don't know all about it. The flu, yes, the flu also kills, but not in as great as numbers as this virus has. So every year when you hear about the flu and some young child, you'll hear usually the extremes. A young child died of the flu or this. You won't hear about the everyday people, because we're so used to the flu and we've had vaccines for the flu. Since this is new, it seems exaggerated because of the news and everything happening at once, but that's what a pandemic is. So it is actual, is what I say. It too, the pandemic phase of it will pass. However, this variant of the coronavirus is likely to be here. And so now that we have it here in humans, the research and the timing is going to have to tell us how frequent, if it's going to be similar to the flu where we have it annually and the annual flu vaccine, we have an annual corona vaccine. That's the information we don't have yet. But the here and now is it is real and it is doing damage. It is killing and it is hurting.
And ladies and gentlemen, if you don't mind me just adding, I think this is critical to note. We're doing this session so that we could try to provide information and factual education that resonates with the listeners and all of the family there at Washington Global. So with that said, Dr. Dunmore had alluded to, until you actually have a personal experience that you encounter with your family members or someone close to you, it's tough to really grasp the significance and magnitude of this virus. But I'll speak from a very personal perspective. Literally, less than 2 weeks ago, a week and a half ago, I lost my father to COVID-19. He was 67 years old. As soon as he was rushed to the hospital, and he probably went a little bit late, being somewhat stubborn, thinking that he could survive some of the symptoms. As soon as he went to the hospital, he was rushed immediately to intensive care, where he received services. Unfortunately, because his oxygen level was so low, they unfortunately he experienced multiple heart attacks and he just was not able to survive it. So, ladies and gentlemen, this is real. It has happened to my family. And just to give some comparison for those that think it's similar to the regular flu, in the United States, on average, we lose maybe 12 to 60,000 individuals from influenza annually. With the coronavirus, we've lost in just 1 year well over 560,000 individuals that we've been able to keep record of. There is no comparison, ladies and gentlemen. And I encourage you, as soon as you have the opportunity to be vaccinated, please do so.
So thank you so much. And if I am so sorry to hear about that, Mr. Walker. It's absolutely tragic, and our hearts go out to you.
And that's why we're here, because we realize as an organization the significance of this virus. Dr. Dunmore and I and the rest of our leadership, and we are more motivated than ever before to be a resource for those that need it. So thank you for that.
So what I'm going to do is just draw a summary at this point. What we want to know is that for prevention, what we want to make sure that people do is to follow the guidelines. Okay, you do want to wear the masks. Okay, you do want to wash your hands. Okay, after every time, anytime you can, anytime you see a sink, soap, and water, you should wash your hands. Have some hand sanitizer with you if you're not going to be able to do that, in your purse, in your pocket, in the car. You also want to make sure that you follow the state or district guidelines according to gatherings. Okay, because right now we've moved up to 25 to 50% in certain scenarios, and there is a people limit. So we want to make sure that we follow those guidelines because they are following scientific data as they open up. Vaccination is number one on that list, so make sure of vaccination. If you're feeling ill, you want to not put those symptoms aside and brush them off. You want to make sure that you check your symptoms and check with the provider and see if you need to be tested. Thank you so much for your time.
Awesome. Well, say thank you again to the Elaine Ellis Center of Health. Thank you so much, Dr. Dunmore. If anyone, listening in or watching, has any other questions, please feel free to reach out. I would be more than happy to put you in touch with Elaine Ellis to get any questions that you have answered. Otherwise, say we will end this a little early so you can enjoy the beautiful weather outside. I hope everyone stays safe, stay healthy, wear your mask, social distance, and enjoy the rest of your afternoon.
Thank you.
Thank you, everybody.
Much.